First, fair, accurate. KVAL News starts right now.
October is Breast Cancer Awareness Month.
Tonight, KVAL News begins a two-part report on breast cancer and what comes after the surgery to save a woman's life. Good evening, I'm David Walker.
And I'm Jennifer Winters. Thanks for joining us. Oregon has one of the highest breast cancer rates in the country. Most women will survive the disease after a long treatment and sometimes disfiguring surgery. 20% of survivors will have reconstructive surgery. Tonight, KVAL's Molly Blancett talks to survivors about the healing of being whole again in this special health alert.
I was married in August of '08, and just a couple months after that, I found a lump and my life changed.
Katie Burke was just 23 years old when she was diagnosed with breast cancer. She had no family history of the disease.
I was kind of in fight mode.
Burke's best option was a double mastectomy. Doctors removed both breasts.
I just wanted to live to be 100, so I was going to do whatever I had to do.
Well, it was very scary, very scary.
Stacy Sisk was 36 when she was diagnosed in January of 2006.
At the time, they said that I was stage 2, and if I hadn't have found it when I did, I wouldn't have lived 3 more years. So I wouldn't have made my 40th birthday.
She went through chemo and 3 different surgeries to remove the cancerous tissue, leaving her breast
pretty much looked mutilated.
And her emotions?
Hiding to get into the shower, trying not to look in the mirror, very self-conscious.
Both women opted for reconstructive surgery. Burke's at the recommendation of her surgical oncologist.
Do you ever think that you'd be seeing a plastic surgeon?
No, I would have never seen a plastic surgeon.
The same day a general surgeon removed Burke's breasts, Dr. Kiya Movassaghi rebuilt them. Sisk had the reconstruction months after the initial surgeries.
Gave me the confidence to know that I am still a woman and I can still look and feel the way I want to. And so it was awesome. It was awesome to be able to have that option.
Her new breasts
will be the best looking thing on my body when I'm 80, I'm sure.
A tough decision, they say, but not one of vanity. Sisk and Burke tell me reconstructing their breasts helped them rebuild their lives by making them feel like women again.
My breasts look really good and I'm really excited.
In Eugene, I'm Molly Blancett, KVAL News.
The New York law requires hospitals to tell breast cancer patients about reconstructive options. A Eugene Plastic Surgeon wants to make that happen here as well. Tomorrow we'll hear from him and talk to a surgical oncologist to see if that puts more patients at risk for the cancer to return. In tonight's Health Alert, last night we introduced you to 2 breast cancer survivors who say reconstructive surgery helped them feel whole again. Tonight we ask the question, should a plastic surgeon play a bigger role in cancer treatment? One Eugene Plastic Surgeon says yes, but is it safe? KVAL's Molly Blancett investigates.
Stacy Sisk was diagnosed with breast cancer in 2006. The news devastated the newlywed. Sisk had reconstructive surgery months after a series of lumpectomies that left her breast
pretty much looked mutilated.
But she says plastic surgery made her feel like a woman again. New Yorkers recently passed a law that requires hospitals to inform breast cancer patients about the availability of reconstructive surgery. Eugene Plastic Surgeon Kiya Movassaghi wants to pass a similar law here in Oregon.
I think the plastic surgeon needs to be part of the cancer team.
He says the earlier he sees a patient, the better the results.
So it allows me to assess the patient's anatomy beforehand. So I know what they look like beforehand, and therefore I can give the patient the best advice for the reconstructive options.
Dr. Movassaghi tells me the best results come when surgeons leave the breast and nipple skin behind during a mastectomy. But is adding a plastic surgeon to the surgery team safe? I asked Eugene surgeon Christian Ferry.
Does that at all put the patient up for a higher probability that cancer could come back?
Well, that I think was a barrier to us doing complete envelope-sparing procedures.
When the surgeon leaves behind the breast and nipple skin.
But the answer really is no. There's been no data. In fact,
Dr. Ferry tells me a law mandating a consult isn't the answer because reconstructive surgery isn't appropriate for everyone. Older patients and heavy smokers may not be good candidates. In those cases, Ferry says the information could add stress and confusion to an already tense time. Movassaghi says he just wants to give people the option. In Eugene, I'm Molly Blancett, KVAL News.
Movassaghi plans to formally push for a change in Oregon law. KVAL News will let you know what happens with this effort.